Now being joined on stage by Rob Leventhal to represent the US and Gilberto Gera on behalf of UNODC. I would now like to welcome Ambassador Fan Ki-tu to open with her welcome remarks.
Thank you, Joanna. Good morning, my dear colleagues in the UNODC and ISSUP. Rob, Brian, Charlotte, and other friends in the INL, State Department of the United States. Excellencies, ladies and gentlemen, I'm very honored to be here today to speak as the 7th Secretary General of the Colombo Plan. Colombo Plan was established on the 1st July 1951 by Australia, Canada, India, Pakistan, New Zealand, Sri Lanka, and the UK, and currently has expanded to 27 member countries, including non-Commonwealth countries and countries belonging to regional groupings such as the ASEAN, the SAARC, and the countries in the Pacific. This is an organization that has pioneered to assist its member states in the post-war development efforts in all areas of infrastructure facilities. Even today, these major infrastructure facilities remain as witnesses as to the historical service rendered by the CP to its members. Nowadays, Colombo Plan programs range from drug advisory to gender affairs, capacity building program, and environment program. Having said that, I would like to move on to speak more on the drug advisory program of the CP, which is very relevant today. These days, we focus on one of the most important topics that concerns not only the CP, but as well as the whole world. The CP is deeply rooted in its efforts and commitment, working with the International Narcotics and Law Enforcement Affairs of the State Department of the United States in spearheading the global fight against the drug menace. I feel that it would be of interest if I present to you in a nutshell the rest of our work. The Drug Advisory Program, DAP, is one of the 4 programs of the CP. It was established in 1973 to address the growing problem of substance use and trafficking concerns of member states and beyond. DAP's primary focus is on the capacity building of individuals, government agencies, non-governmental organizations, and civil society who are currently working on enhancing their knowledge, skills, and competencies in the demand and supply of substance use and abuse. DAP's projects encompass curriculum development and training on the universal prevention and treatment curricula, as well as specialized curricula. The 2 main curricula are Universal Prevention Curriculum for Substance Use for Coordinators, UPCC, and Implementers, UPCI, designed to educate substance use prevention practitioners on the science, knowledge, skills, and competencies associated with the implementation of evidence-based prevention interventions in various settings such as family, school, workplace, and community. The Universal Treatment Curriculum for Substance Use Disorders, UTC, focuses on current evidence-based practices in the delivery of treatment services. The specialized curriculum includes the Child Intervention for Living Drug-Free Curriculum, CHILD, Recovery Coach Curriculum, RC, Sexual Orientation and Gender Identity Curriculum, and the Women Interventions for Substance Exposure Curriculum, WISE. The CHILD curriculum supports the provision of age-appropriate treatment services for children with substance use disorders, while the recovery curriculum provides knowledge and skills on peer-led interventions to recovery coaches working in the community. The sexual orientation and gender identity curriculum gives an overview of substance use and health-related issues amongst community, and the WISE curriculum aims to address the existing gaps in training for treatment providers working with women to empower those in recovery and to support others in maintaining their own recovery. In 2018, A total of 3,300 individuals from 33 countries were beneficiaries of approximately 80 training programs conducted on the evidence-based training curricula, an increase of 35% from the previous year. Credentialing for addiction treatment practitioners is offered through Global Center for Credentialing and Certification, GCCC. It's the form of the International Certification of Addiction Professionals Examinations. As a prime mover in the drug demand reduction DDR field, DAP is continuously developing new and innovative programs. Currently in progress is the development of a curriculum for individuals working in the criminal justice system, that is, drug treatment alternatives to incarceration for drug user curriculum. This curriculum aims to provide policymakers with the necessary tools to design country-specific alternatives programs this curriculum will be ready for dissemination this year. DAP also supports international conferences organized by ICU-DDR, Afghanistan Stakeholders Meeting, Prevention and Treatment Expert Advisory Grouping meetings that facilitate intellectual discussions among DDR experts field and share current trend in the field. DAP continues to provide direct technical assistance to about 80 treatment centers in Afghanistan, thus enabling about 10,485 individuals to have access to the free treatment and aftercare services. In addition, DAP also supports several outpatient treatment centers in Indonesia, Bangladesh, and the Philippines. Since the launch of ISSUP in 2015, DAP has been supporting the annual International Society of Substance Use Prevention and Treatment Professionals, ISSUP, in the form of concurrent workshops on selected courses of the UPC, UTC, CHIDE, and WISE. Besides the GCCC Commission meeting and the credentialing examinations for trained addiction treatment practitioners. This year, ISSUP DAP is once again offering training opportunities to DDR practitioners in the form of concurrent training workshops on the UPC, UTC, CHIDE, as well as the UTC refresher course. The CP, through its DAP, has worked tirelessly over the years on major initiatives on drug demand reduction programs. Periodically, these programs have been reviewed and new initiatives have been introduced to reduce the demand and to step up the efforts. The CP collaborates very closely with ISSUP. The CP supports ISSUP by providing, like I mentioned before, technical assistance and conducting training programs at ISSUP's annual workshops. This year, the annual ISSUP workshop takes place here in Vienna and is organized in collaboration with the United Nations Office on Drugs and Crime, UNODC. CP, through its DAP, will be conducting 9 simultaneous training workshops of its drugs use treatment and prevention curricula. All these training workshops will be held in M building of this international center. Please join us at ISSUP to get an understanding of the CP involvement in the provision of technical assistance and capacity building in the field of drug demand reduction. Having said all this and inspired by the key work done by ourselves in collaboration with our partners, I feel that it is obligatory for us to give the right direction to the next generation in what it means to lead a drug-free life. To do this, we are mobilizing resources and our manpower to do our programs, mainly through education, raising awareness, and training and treatment facilities. We have done a great job. Let us not stop there. Let us move forward to assure that our children and grandchildren will live in a healthy and safe world. Thank you.
Thank you very much. And now I hand over to Angela Crowley, the Assistant Executive Secretary of the Inter-American Drug Abuse Control Commission of the Organization of American States.
Thank you, Joanna. Distinguished national and international experts and delegations, esteemed participants, friends, good morning, afternoon, or evening, or whichever time frame you feel you're on. It is an honor to address you this morning here in Vienna and be part of such an impactful agenda. Greetings from Ambassador Adam Nam, Executive Secretary of the Inter-American Drug Abuse Control Commission, which is part of the Organization of American States, OAS. I'm privileged to be here with 5 of my colleagues who are scattered around the room. I'm sure you'll meet them today. They carry out CCAD's demand reduction and institutional strengthening programming, including drug prevention, treatment, and rehabilitation, together with alternatives to incarceration for drug-related offenders, which we are implementing in 15 member states and growing. CCAD is the consultative and advisory body of the OAS on the drug issue. It serves as a forum for OAS member states to discuss and find solutions to the drug problem, and provides them with technical assistance to increase their capacity to counter the challenges faced. Our hemispheric drug strategy and our plan of action set priorities for our member states, placing individuals at the core of drug policies and including a cross-cutting perspective on human rights, on gender and development, with a focus on evidence-based drug policies. With the invaluable financial support from US INL, for which we are grateful, CCAD continues to work with OAS member states to implement our plan of action and the UNGAS operational recommendations to address the challenges posed by the drug problem in the various areas of institution building, supply and demand reduction, control measures, and international cooperation. Demand reduction is at the core of our programming. Drug dependence is seen by OAS member states as being caused by many factors, including biological, psychological, or social, which must be addressed and treated as a public health matter, consistent with the treatment of other chronic diseases. To address this issue through our plan of action, OAS countries have a number of priority policy actions to implement through 2020. These include the promotion of national prevention, treatment, care, recovery, rehabilitation, and social reintegration measures aimed at minimizing the adverse public health and social consequences of drug abuse, the monitoring and the evaluation of the results of care, treatment, and rehabilitation, and the development and implementation of evidence-based drug use prevention strategies and programs in the school, family, work, and community spheres. Monitoring trends in drug use is one of the most important ways to evaluate the impact of drug policies. In March of this year, CCAD published the Report on Drug Use in the Americas 2019. This report provides information on key indicators of drug consumption across the Americas, as well as a valuable analysis of trends that will assist in the design and implementation of more effective drug policies. The report highlights the decreasing age of first use among both boys and girls. Research tells us that the earlier people begin using drugs, the higher the probability of long-term health effects and dependence, thus the need for effective preventive interventions. Gender and drug use is an increasingly important topic. While drug use is historically seen as a male phenomenon, data shows that females in most OAS member states use certain drugs at equal to or higher rates than men. Alcohol prevalence is nearly equal between male and female secondary school students, while the gender gap for cannabis is shrinking. Females are much more likely to use pharmaceuticals without medical prescription. Misuse of tranquilizers is higher among females than males in almost every population studied. And stimulant use by women is higher in many countries. Pharmaceutical misuse includes opioids and new psychoactive substances. One of the most dangerous of these substances, as you know, is fentanyl, which has already had a devastating effect in Canada and the US. Unfortunately, opioid abuse is beginning to also appear in Latin America and the Caribbean. Misuse of opioids, MPS, and pharmaceutical present particular challenges for the drug treatment services. The appearance of NPS also poses threats to the health of law enforcement officials who handle these drugs. Changing patterns of use, new drugs, and the health impact of these substances need to be better understood, and efforts to reduce drug use will be effective only if they're based on scientific evidence. Another tool CCAD has to measure the success of national drug policies is a peer review process called the Multilateral Evaluation Mechanism, the MEM. The MEM is the only tool of its kind in the world. The MEM will soon publish reports on how each OAS member state is implementing priority actions from our Hemispheric Action Plan on Drugs and UNGAS. These will soon be available on our webpage and will provide a valuable insight into where vulnerabilities lie in demand reduction and other drug-related areas. In addition to helping OAS countries improve their approach to the drug problem, the MEM reports will also help international organizations and donor agencies target the necessary areas to strengthen national policies. I was privileged to attend ISSUP in Kenya 6 months ago, and I recognize the value of ISSUP conferences in providing a key framework for dialogue and consultation among global experts on prevention, treatment, and recovery, as well as offering an impressive schedule of thematic panels and invaluable training opportunities. CCAD looks forward to contributing in panel discussions and presentations, such as the institutional capacity in the implementation of alternatives to incarceration under judicial supervision for drug-related offenders, and the importance of evaluating policies to improve programs in Latin America and the Caribbean. CCAD will also offer training this week for treating adolescents with substance use disorders. As our 2019 drug use report shows, cannabis use among secondary school students is increasing in most countries, and high-risk behaviors associated with alcohol, such as early initiation of drug use and binge drinking by secondary school students, are a concern. Clearly, today's youth face many risks. Drug abuse continues to be a dangerous way for many young people to cope with various socioeconomic and psychological problems. Keeping in mind that youth are such a vulnerable population, it is crucial for the international community to address this matter. Effective drug demand reduction partnerships lead to effective programs and services for all who suffer the consequences of this global problem. ISSUP 5 provides us with a platform for an exchange of ideas, perspectives, and experiences so as to foster strategies that benefit those suffering from drug dependence. Thank you all for your attention. I look forward to an inspiring week ahead, and as Joanna says, this is a family ambience, and I'm pleased to be part of it. Thank you very much.
Thank you, Angela. Now we'll be hearing from Dr. Vladimir Posniak, who is the coordinator of mental health and substance abuse at the World Health Organization.
Thank you, Joanna. Excellencies, distinguished guests, ladies and gentlemen. It's my privilege and pleasure to welcome you here today on behalf of the World Health Organization, specialized technical agency of the United Nations for Health. It's good to see that the ISSUP conference is held in the UN city in Vienna that hosts the headquarters of the United Nations Office on Drugs and Crime. UNODC is our main partner within the UN system in addressing public health dimensions of the world health drug problem. Several products and activities of our collaboration on prevention of drug use and drug dependence treatment and care will be presented and discussed during the conference. I came here to Vienna just a day after the second WHO Forum on Alcohol, Drugs and Addictive Behaviors finished its work in WHO headquarters in Geneva. And I see many faces who were present in Geneva last week. The forum brought together representatives of governments, civil society, and academia, major stakeholders for addressing any global challenge. We need to ensure appropriate engagement of all of them, as well as private sector, in addressing such complex and multifaceted challenge as the world drug problem. One of the most dramatic manifestations of the impact of drug use on health is drug-related death. An increase in opioid overdose mortality is well documented in recent years in several countries, but many more countries around the world have a similar problem or are at risk of opioid overdose crisis. According to WHO estimates for 2007, more than 70% of 500 million drug-related deaths in the world were due to opioids. Reducing drug-related deaths continues to be a public health priority that requires concerted actions of all stakeholders. Less than a week ago, we observed the International Day Against Drug Abuse and Illicit Trafficking. In WHO, we hosted the Geneva launch of the UNODC World Drug Report, and colleagues from UNODC came to present their flagship publication in Geneva. The report reconfirms what we know and what WHO and UNODC communicated for years. Prevention of drug use and treatment of drug use disorders continue to fall short in many parts of the world. At best, 1 in 7 people with drug use disorders receive treatment each year. Treatment coverage for drug use disorders is a major challenge. The universal health coverage is among the 3 strategic priorities for WHO as presented in our General Program of Work for 2019-2023. This program, endorsed by our member states, is built around triple billion goals. 1 billion more people benefiting from universal health coverage, 1 billion more people better protected from health emergencies, and 1 billion more people enjoying better health and well-being. Universal health coverage means that everyone can have access to health promotion, prevention, rehabilitation, and palliative care through the course of their lives in all contexts and settings. Everyone, including people who use drugs and people suffering from drug use disorders. Health is fundamental human right, and that means access to quality essential healthcare services, including harm reduction services for injecting drug users. It means access to safe, effective, quality, and affordable essential medicines, and it means financial risk protection when receiving treatment. As Dr. Tedros, WHO Director General, said, and I quote, "Within our grasp is the chance to turn the vision of universal health coverage into a reality for everyone, including the most neglected individuals and communities." That definitely means people who use drugs and people with drug use disorders. No doubts that this conference, the Conference of International Society of Substance Use Professionals, will make its own contribution to improving access to health promotion, prevention of drug use, reduction of its negative health and social consequences, as well as treatment and rehabilitation of people with drug use disorders. In WHO, we are pleased to contribute to the conference program with several presentations and WHO UNODC workshop on identification and management of substance use in pregnancy. It is our common and shared responsibility to accelerate our efforts towards achieving the Health Target 3.5 of 2030 Sustainable Development Goals that calls for strengthening prevention and treatment of substance abuse. We all need to play in one tune a magic flute, the Zauberflute, that unites all in promoting evidence-based and ethical prevention and treatment interventions. In WHO, we are prepared to scale up our collaboration with all partners within and outside the UN system towards achieving this target, and hopefully this conference will help to make it happen. Thank you.
Thank you very much. Now we will be hearing from Mr. Alexis Quel, the Director of the European Monitoring Centre for Drugs and Drug Addiction.
Thank you, Chair. Good morning, everybody. It's a real pleasure to be part of the family today, especially as from my professional background, I am a clinician. I'm very happy that we have such a big meeting gathering people working on prevention and treatment from all the continents. Let me first share with you a few figures about the drug situation in the European Union. 9,000 drug-related deaths. Last year, 55 new NPS detected on the European market, while another 350 have popped up here and there on the European Union territory. Overall increase of availability of cocaine, to some extent heroin, increase in potency, purity for all substances, including stimulants and cannabis, polydrug use, But on the other hand, over the last 25 years, as a result of those efforts, the common efforts of the EU member states, we have 650,000 people who are in treatment in OSTs, which means that we are covering more or less 50% of the needs for the opioid users. We have between 1.2, 1.3 million of people who are in treatment all over the EU. In the EU last year, there were around 80 million of syringes that have been distributed in the different member states. We see an increase in the new needs for new forms of treatment, but at the same time, we managed to reach the lowest ever level of HIV infections in the last 2 decades in the European Union. So in the European Union, the approach as far as demand reduction is concerned is of course covered by the strategy of the EU on drugs. That is a common strategy between all EU member states, which is also supported by the adoption of minimum quality standards. I would like to stress that in the EU, drug policy is designed and implemented, of course, in accordance to EU and national legislation, but above all, it is including the Charter on Fundamental Rights, which is also applicable to every people using drugs on the territory of the European Union, which means also that to develop better responses to the problem, it is important to associate clients, to associate persons who are using drugs. Over the years, the member states, with the support of the EU and the EMCDDA, have built a portfolio of demand reduction interventions covering prevention, treatment, harm reduction, social reintegration, and promoting the application of evaluation methodologies in order to develop and strengthen best practice. The role of the EMCDDA as the European Drugs Agency is to contribute to a healthier and more secure Europe through better informed decision and action. And of course, as far as demand reduction interventions are concerned, we have a broad set of activities I will not list today, just making a reference to the European Guide for Health and Social Responses, to training, education, and training and capacity development program. Of course, we are going to publish in September the EU PC manual, and currently this week is the 2nd week of the summer course we organized together with the Lisbon University Institute with the special focus on drugs in prison. What are the new projects? Well, the new projects is in the future more support to training capacity development, not only covering the territory of the EU, but as a support to EU policy on drugs with non-EU countries, close cooperation with the Western Balkan countries, close cooperation with the countries neighboring the EU, and also direct support and very close cooperation from the beginning with COPOLAT in Latin America and with CADAP in Central Asia. We have also, as specific to the MCDDA, we have a new public health unit that was created 1.5 years ago. We have three priorities in public health. The first is to make a significant contribution to reduce the drug-related death in the European Union, which means also knowing better what are the criteria for best practice for programs such as naloxone, but also drug consumption rooms. The second priority is to contribute to increase the access to treatment and to testing for Hep C, and we have a special initiative in that direction. And last but not least, to contribute to increase the adoption at national or local level of those best practices in the area of prevention. And of course, all of this we do it through a very close cooperation with you, our colleagues and friends from the broader family, from ISSUP, but also UNODC, WHO, and CICAT-OAS. And I would like to finish by stressing that one of our biggest challenges that we have in front of us in the European Union is that the golden generation, if you allow me to call them like that, because there are those who made all those significant changes in the EU the last 30 years, when there was the outbreak with the heroin epidemic, when we had then the HIV/AIDS epidemic, and then Hep C, this golden generation from whom we have learned so much for treatment, for prevention, for harm reduction interventions. This generation, at least in Europe, is progressively living on retirement. Therefore, we need to prepare the next generation. And this we can reach not only through training and education, but it's a real challenge, it's a real mission of transmission, not only of technique or know-how, but of values, principles, and the ethics of our work. Thank you very much.
Thank you. We will now be hearing from Jane Marie Angola, who is the Head of Social Welfare at the African Union Commission.
Thank you, Joanna. Excellencies, distinguished guests, ladies and gentlemen, it's an honor for me to address you this morning on behalf of my commissioner, Mrs. Amira El-Fadil, Commissioner for Social Affairs of the African Union Commission, who would have loved to be with you here today. But this week, all the policy organs of the African Union Commission are having heads of state summit in Niamey, Niger. We are privileged as the African Union Commission to be part of this global conference and to join UNODC and Europe to host this conference. Last year, the conference was hosted by Africa, and we can only be happy to work with other continental and regional organizations to be hosting similar events. African Union will remain committed to the objectives of ISSUP, especially as it is a platform for substance use prevention and treatment to be revolutionized as a field of activity that can be based on evidence, quality standards, and sound ethical best practice. Echoing previous speakers, the gathering could not have been more timely, coming just a few days after the launch of the World Drug Report, which, by the way, was also officially launched at the African Union Commission as one of the 4 hubs where the launch took place concurrently. The findings from the World Drug Report, glaring, and more so for Africa. And if I just restate some of the figures. 35 million people globally suffering from drug use disorders. This increase of global burden of disease attributed to drug use. Increase in the non-medical use of prescription drugs, in particular for Africa, tramadol, which is becoming a threat in most countries. And having said that, the availability of and access to treatment services remains limited globally. 1 out of 17 people with drug use disorders receiving treatment each year. And for Africa, 1 out of 18. And majority of those receive treatment for cannabis use. The stark reality is that prevention and treatment continue to fall far short of needs in many parts of the world. Our question, which hopefully ISSUP will address, is how do we respond to the challenge in terms of quality, availability, and reach, especially in developing countries that have largely experienced disproportionate impact of drug abuse and drug trafficking, manifested in health challenges, socioeconomic challenges, and well-being of the people, including national security. Over the past few years, Africa has not only become a major transit route in the global trade in narcotics, but also a major consumption market, posing serious health, security, and social challenges. But at the same time, many countries in Africa face the twin challenge of balancing necessary access for medical purposes while curbing abuse at the same time, with limited resources and healthcare systems that are already struggling to cope. We, as the African Union Commission, were excited to join the global community today, the global community of professionals commonly oriented towards the same goals. It is a dialogue that we should carry forward into the future as we experience common challenges. The meeting that we had in Nairobi last year revealed a lot of commonalities between the African region and the Latin American region. So as we dialogue, we carry on the conversation and develop new approaches to address these common challenges. I would wish, therefore, to express commitment of the African Union to continue providing leadership needed to push forward the agenda for the health and well-being of its citizens, and to provide policy guidance and platform for learning and knowledge sharing for its member states. Some of the activities and the policy directions that the African Union offers includes, we have been developing comprehensive and balanced drug control strategies, the current one being the revised AU Plan of Action on Drug Control and Crime Prevention, covering 2019 to 2023. It will be adopted by African ministers of health, population, and drug control at their biennial meeting at the end of this month. We need data and evidence to link science and practice. In this regard, the African Union works with its member states to strengthen and establish national and regional drug epidemiology networks for systematic data collection in member states. And in this regard, I would really like to acknowledge the support of INL, who's worked hand in hand with the African Union Commission to make sure that that happens. The networks will progressively address the lack of data, baseline data and information on drug use as a major hindrance to the adoption of evidence-based treatment and care, including harm reduction services for drug-dependent users in African Union member states. I am happy, therefore, to report that while not giving any statistics at the moment, the first continental epidemiology report, drug epidemiology report, will be launched during the same ministerial meeting at the end of this month. In improving capacity of professionals in this field, during December last year, Africa launched the African chapter of International Consortium of Universities for Drug Demand Reduction. And in September this year at the African Union Commission, they'll be having the first major meeting to roll out how to promote research and the application of evidence-based practices to prevention and treatment services. I cannot overemphasize how this will immensely help Africa to increase the number of its addiction professionals and begin to seriously professionalize the addiction workforce. Our concern as the African Union today is capacity. Capacity and capacity. Treatment that's currently provided, a number of those receiving treatment is for cannabis use only. How do we scale up? Therefore, as I conclude, it is my conviction that this ISSUP, through the plenary sessions, the workshops, training sessions, and networking experiences, will provide us with an opportunity for more serious introspection on how we approach treatment and prevention. That it will be science-driven, it will be accessible, and scaled up if we have to reach the numbers that all the speakers have talked about. Thank you all for listening to me, and look forward to inspiring and engaging week. Thank you very much.
Thank you, Jo Marie. Now I would like to welcome Eric Servo, the Vice President of International Programs from the Community Anti-Drug Coalitions of America, CADCA.
Well, thank you, Joanne. And it is a pleasure to be here with all of you today. First and foremost, I'd like to send greetings on behalf of CADCA's Chairman and President, General Arthur T. Dean. and also to acknowledge and extend my gratitude to all of the partners here today for giving us this opportunity to be here with you and sharing a little bit about what we're doing around drug prevention and the world drug problem. First, I'd like to thank ISSUP for the opportunity to present to all of you today, to our friends and colleagues at the State Department's INL, as well as all of the distinguished colleagues here at the table today from Colombo Plan, OASC-COD, WHO, African Union, European Monitoring Center for Drugs and Drug Addiction, and Drug Free America Foundation. And also all of you that are here today representing more than 120 countries around the world at ISSUP's 5th annual training. So CADCA is an international organization based out of the United States. We've been in existence since 1992 when we're formed out of a Presidential Drug Advisory Council. And CADCA exists for one specific reason, and that is to serve local communities, to help them come together, enhance their capacity to build multi-sector community coalitions that have the aim at reducing drug use at the local level, with the ultimate goal of creating safe, healthy, and drug-free communities. And some of the ways that we go about doing that is, well, first, community coalitions. At its core, it's really about finding local solutions to local problems and looking at our communities as the resource. And we do that by bringing together a broad range of actors at the local level, including youth, parents, residents, along with institutions and organizations that represent education, health, local government, law enforcement. We also need the business community, faith community, as well as the health sector and youth-serving organizations, media, and other amazing resources that we find right there in our local community. And the point is to bring them all together to start developing comprehensive plans and strategies, really looking at what's happening in the community and what can they do collectively to have an impact and bring about positive outcomes at the local level. Now, from one aspect, that's one of the ways we work at CADCA, but it's not just enough to bring people together. We also need to provide them with evidence-based tools and strategies to help them develop comprehensive plans and approaches that will allow them to be focused on what the drug challenges look like in their communities and how can they develop comprehensive plans to see those problems get reduced and changed over time by bringing about changes in the conditions that are found in local communities and really looking at the systems and the policies and the practices that communities have around them so that we can achieve population level outcomes, changes that will impact everyone at the local level. Now, CADCA's been doing this, as I said, since 1992 in the United States, and we represent a network of over 5,000 community coalitions across the United States and all the US territories. And back in 2005, we had the great privilege to begin working with our State Department, with INL, to take this successful model and approach that had been impacting so many communities across the United States and replicating it abroad. And since that time, we've had the distinct pleasure to not only first replicate this throughout Latin America, but then the work spread throughout Africa, Central, Southeast Asia, and most recently into Europe. And today, we now have a global network of over 265 community coalitions in 26 countries around the world. And one of the things that we're working towards is collective impact in each of these countries. It's not just enough to develop one coalition, but to develop a prevention infrastructure where we have boots on the ground in communities. And looking to also not only instill capacity at the local community level, but also establishing national networks or associations of coalitions, working with national governments to work within political and economic strategies, structures that are in place to institutionalize the practices of empowering local communities to have that voice on the ground and to be those, well, agents of change in bringing about an impact to the drug problem. Now, I would like to also mention that this week here at ISSUP, we're going to be offering a training as well, titled Collaborations with Government and Civil Society through the Community Coalition Construct. Now, the training isn't just going to be about CADCA and its methodology. We also have our partners here with us from the Philippines and Albania who are going to be sharing how this model has been adopted and adapted within their local context and what community coalitions and the work they're doing in their communities and types of impact that they're having. I'd also like to say too that as part of the work that we do with community coalitions around the world and these networks of coalitions, is we try as often as possible to bring them together to share practices, knowledge, skills, and experiences where they can enrich each other from experiences throughout the different hemispheres and different parts of the world. And in less than 2 weeks, CADCA will be hosting its Mid-Year Training Institute where we really bring the field of community coalitions together. This year it'll be in Dallas, Texas, and we'll have over 2,000 participants there, of which 26 countries will be represented as well. And really the focus is about, again, sharing those best practices, knowledge, skills, and experiences. And with that, I'd just like to say too that we have a very unique opportunity here this week at ISSUP. When I look around this room and I see a remarkable network of over 120 countries represented here today, I just like to say that, you know, the week will go by extremely fast, but there's a remarkable opportunity to meet new people, to share perspectives and experiences, and really, you know, at the end of the day, individually, we, you know, there's a limited space with what we can do, but collectively, especially through networks such as ISSUP, we really can achieve more through collective impact. So I'd just like to say that in the spirit of what we do at CADCA, it's also in the spirit of what we do here at ISSUP. So I just want to wish everybody a remarkable week in sharing and experiences and knowledge and skills that we all possess as we're all working towards that same goal of having a safer, healthier, drug-free world. Thank you.
Thank you, Eric. And now we would like to hear from Amy Ronshausen, who is the Executive Director of the Drug-Free America Foundation.
Welcome, thank you. We're very honored to be part of this distinguished panel during opening ceremonies. Drug-Free America Foundation is a prevention and policy organization committed to developing strategies that prevent drug abuse and promote sustained recovery. We are a non-governmental organization in special consultative status with the Economic and Social Council of the United Nations, and our vision is a world where all of its citizens live free from the burden of substance abuse. This week, it is our privilege to conduct a 3-day drug-free workplace training. Establishing a safe and healthy and productive workplace environment has long been the goal of governments, businesses, and non-governmental organizations around the world. Many employers strive to provide a safe work environment and encourage the personal health of their employees. Our training will discuss best practices in policy and how to establish or enhance current drug-free workplace programs. These policies should not be punitive in nature, but rather they should be designed to promote the health of employees by preventing substance abuse, assisting those that are drug dependent, and supporting treatment and recovery efforts. If you're not signed up for this training, and it looks like that would be about almost 400 of you, you are in luck because we are in the process of setting up a virtual work group on the ISIS website that will be used for sharing experiences, looking at new research, promoting best practices, and discussing the challenges that are unique to each one of your communities. So come find us this week and we'll tell you a little bit more about that as we find out more about that. Preventing drug abuse, curbing addiction, and increasing the number of people in recovery requires a focus on policy reform, family and community engagement, and education. This joint conference with ISSUP and UNODC is an amazing opportunity to learn for each other and cultivate those new partnerships. Last month, Drug-Free America Foundation hosted our annual gala, and the theme was Grow Hope, and Hope Grows. Hope Grows serves as a reminder that we all have a role to play in finding solutions to the global drug crisis. On behalf of Drug Free America Foundation, I want to thank each one of you for your commitment in being here this week. The knowledge that you will take back, the new partnerships you will forge, and the people you will meet will allow you to grow hope in your communities and around different parts of the world. And for us, it's just really a great honor to be here and meet all of you. Thank you.
Thank you to all of the speakers for making their welcoming remarks and officially opening this event. Alongside the plenary sessions that are taking place in this room until Wednesday afternoon, there's a number of trainings taking place which you've heard about. Some of those are going to be starting this afternoon. So we have the training for treating adolescents with substance use disorders, the children's substance use prevention and treatment courses, as well as UPC core and schools, and UTC basic counselling skills, and advanced clinical skills and crisis management, alongside the UTC exam refresher course. So they will all be starting this afternoon. Thanks to all of you for listening and being part of this opening ceremony. Don't forget to visit the ISSUP website, where there is a network called Inspiration and Direction, where we can all share with each other and post experiences of the week and keep that conversation after the event has finished, as well as keeping to using any social media. Have a fantastic and very productive week. And beyond this week, I really wish you luck in your day-to-day efforts, because you are the ones that are driving this forward, making the difference. I encourage you all to keep going and enjoy your week. Thank you.